Yeah.
So.
All right. So my name is Dr. Anaban. I'm a veterinary consultant surgeon associated with St. Albans Vet. I've examined Doof. Doof is severely affected in the way his front legs bend. The angle of curvature is more than I've ever seen in any previous dog I've ever seen. The level of at which the bone has bent is a very abnormal level, and this an attempt at surgery may result in the surgery actually failing, in that the bone plate and screws might come loose.
So can you explain, like you did with your arm before, why with a regular like malnutrition sort of one, it bends at a different angle, but with Doof it's different. So could you explain so you can show that?
This is his front leg. The curvature generally happens in the middle of this bone. The radius and ulna is here. The two bones are here, rather, just like with him, radius and ulna. The bones generally bend in the middle. So when they bend, they curve like this. And so when we try and reset the leg, we cut right in the middle and take out a wedge, such that there's equal portions of bone above and below the cut. And when one has straightened the portion below where one is cut, there's enough bone above and below for an equal number of screws to be put on the bone plate, which holds the whole bone together. And the result of that bone healing means ultimately firstly the bones are going to join in a straight manner, and secondly the bone healing is almost guaranteed because of the equal number of screws. So the result of it all is usually a very good cosmetic effect where the bone looks normal again. With Doof, the curvatures happened at the 90% mark down the bone.
So it's where it's been broken in the past.
I suspect it is broken. I can't confirm that. But what I can see is the end result. So this 90% of the bone is straight. The bottom 10% is curved. So when one cuts that, we've only got a 90 to 10 sort of differential in the length of the bone. So with the portion that's below the cut, there physically isn't enough bone for more than 2 or maybe 3 small screws to be placed. There really should be about 5 or 6 screws in that segment. So because we only have a space for a couple of screws, or maximum a third small screw instead of 5 or 6, there's a chance that those screws will break. And then we end up with a cut bone, which we can't heal.
Is it possible to actually have something on the outside of his leg that will keep it straight?
Like, you know how you see they're like metal things?
Exactly. So that, exactly what you pointed out. Sometimes when we have similar curvatures, what happens is the bone is cut and there's something outside the leg, a circle, a wheel type structure with pins going in, which act as the anchor for that small piece. We've seen ads like that, seen shows like that. The technical equipment we have here, we don't have that. We don't have that.
Can't do that.
We technically are restricted in this practice by that.
But it can be done at other practices?
So I have to go back to those words, advanced vet care. There is a possibility that because that's a specialist center, which really deals with case levels that are beyond me, even as a consultant surgeon for other vets, they might be able to replicate that. So it's called a radial fixator, I think. There's a few different names for it, but it's a circular wheel that holds a small piece with multiple pins going in different directions, usually 4 or even 5 of those going in. So we don't have the equipment here to do that.
Would it be possible for you to contact them and explain that to them?
Yeah, sure. I'm happy to do that.
So Advanced Vet Care is really the only place that can do it?
Well, you said you were going to try.
The only way I can try is by still doing the bone plating, the internal bone plating. So the thing is, if I had to put a figure on it, then there's a significant chance of them breaking down. And what is a significant chance? Anything more than 20% is a significant chance of it breaking down. And if I've cut it and there's a 20% chance it breaks down, then what? The bone's being cut, and it's dangling then. Yeah. So that risk in my mind is a bit too high. If it was a 2% chance, then it'd be worth it. 20% chance, geez, then what? So then I would have to probably refer you to advanced vet care after doing my surgery and it's broken down. And I'm just thinking 5 steps ahead. I just think that would not be a good outcome. Yeah. So I'm very happy to contact Advanced Vet Care, the specialist centre. It's got the main clinic is in Kensington. I visited it many years ago once. Yeah. And contact them on your behalf, on Doof's behalf, and do some groundwork. Yep. Yeah. Very happy to do that.
That'd be great.
So we were going to meet last week anyhow, so we preponed the meeting. So I've got a bit of time. I can do that contact this week.
That's great.
And I will take your number down, maybe just on my phone or something, and I'll be in touch with you directly. Okay. All right, and I'll give you one of my business cards so you have my number and email address as well. Excellent. So you can keep in touch with me directly. So my role, as I say, I'm a consultant surgeon for other vets, so I'm connected to 12 practices. When they have complex surgery cases, I come and do that for them. So we can keep in touch directly. That's what I'm saying.
Yeah, but it's too complex for you at the moment.
I suspect if I were to do this, it would fall in the experimental surgery category.
Yeah. So, okay.
Yeah, we need.
So I'll do the groundwork.
Okay, thank you.
We really thank you so much.
Yeah, sure.
Appreciate
I'll do the groundwork.
Because he deserves a good life.
Yeah, he's come too far to not.
And it's very pleasing, just talking about the money that has been raised, and I'm saying this on record. It's very pleasing to see the number of people who are involved in his welfare, who very much desire the best for him.
Yes.
He is extraordinarily affected.
Yeah.
I have never, this is my 22nd year of practice as a surgeon. I have never seen a case as severe as him.
Yeah,
so he's extraordinarily affected. I started surgery in 1996. This is 2018. So he is very affected.
Yes.
So I'm sorry, but
No, we understand.
We understand. We're glad there's another option. I'm glad there's someone I know.
And it's an option that you've already heard of from the past.
Yes.
So I'll find out from them if firstly they can do it, and secondly a ballpark figure. And I'll be in direct communication with you.
Okay.
All right.
Great. Thank you.
Excellent.
Bye.